Thank you, Madam Speaker. I wish to thank you for this opportunity to address this Honourable House on matters of critical importance to the health sector, and indeed to every single citizen and visitor to our beautiful country. Madam Speaker, this government recognizes that a fully functional health system is one of the critical pillars for achieving true social and economic development. It is against this background that the Ministry of Health has embarked on a number of initiatives to introduce cardiology services right here in Dominica. In October 2013, the Ministry of Health engaged the services of Dr. Nancy Drucker, pediatric cardiologist from Fletcher Allen Medical Center at the University of Vermont in the United States of America, to provide specialized cardiology services for children in Dominica. A total of 20 pediatric patients were seen and 15 echocardiograms, that is special ultrasound of the heart, were performed. Out of the 15 echograms done, 4 cases were identified as needing open heart surgery. Madam Speaker, this initiative complements another initiative that the Ministry of Health has established with the World Pediatric Project in providing cardiology services and other highly specialized services. The Ministry of Health has been partnering with the World Pediatric Project, that is WPP, a non-profit humanitarian organization based in Richmond, Virginia, and St. Louis, Missouri, with a Caribbean hub based in St. Vincent. WPP's mission is to provide children from developing countries access to advanced pediatric critical care. Under the project, 165 children have been evaluated, and out of this, 27 have had surgical interventions ranging from neurosurgery, plastic surgery, complex bone surgery of the spinal column, surgery of the urogenital system, that is the bladder, eye surgery, and indeed heart surgeries in the United States. To date, the value of the services received by Dominica's children is over $3.1 million at no cost to the taxpayers of Dominica nor to the families of the children. Madam Speaker, I'm using this medium to inform the nation that all children under 21 years can benefit from this program free of cost to their families. Madam Speaker, the ministry is considering expansion of the project to include a community outreach model for cardiology services using a preventive approach to identify children with early stages of heart disease. This component of the project will consist of screening clinics to be held at schools throughout the island, targeting children who are most at risk with congenital and acquired heart diseases. Madam Speaker, this trust in establishing services for heart disease right here in Dominica is not only focusing on our children, but also on our adult population who are affected by heart diseases. Clearly, there are many persons who cannot afford to pay for these services overseas. In September 2013, we have installed echocardiogram equipment at the Princess Margaret Hospital and have employed an echo sonographer and have aggressively begun recruiting visiting cardiologists for the development of our cardiological services. I am therefore pleased to inform this Honourable House that we have begun a partnership with the Champlain Valley Physicians Hospital in the United States in offering expert cardiology services at the Princess Margaret Hospital. In November 2013, Dr. Walker-Wiss, Chief of Cardiology at the Champlain Valley Physician Hospital, and his wife, Mrs. Marla Walker-Wiss, an echocardiography sonographer and instructor by profession, conducted the first of a series of visiting consulting cardiology clinics for adults at the Princess Margaret Hospital and at the Marigot Hospital. Madam Speaker, I am also pleased to inform this Honourable House that the Ministry of Health has also begun a very important partnership with a Trinidadian-born, USA-based and USA board-certified cardiovascular surgeon, Dr. Anthony Nunez, in conducting cardiology services at the Princess Margaret Hospital. Dr. Nunez is serving as a highly specialized visiting cardiological surgeon at PMH. Dr. Nunez plans to take up residence in Dominica. This new initiative is being undertaken using a phased approach for the development of the vascular screening and interventional vascular programs focused on three basic areas, namely, 1, peripheral artery disease, 2, blood clots specifically to prevent life-threatening pulmonary emboly, 3, heart blocks, which will require pacemakers. The first phase, which consists of free cardiovascular screening clinics under this new program, has commenced at the hospital as early as last week, where over 30 patients have been screened. These clinics will be conducted monthly at the Princess Margaret Hospital. Under this initiative, the systems are being put in place to perform interventional cardiovascular services, such as placement of stents and balloons and pacemakers right here in Dominica in the not-too-distant future. We are committed to positioning Dominica as the epicenter for cardiovascular services in the OECS. Madam Speaker, our record in preventing preventing death from heart attacks speak for themselves. I am indeed pleased to refer you to the data in the following graph, which shows that death due to heart attacks in Dominica have been declining steadily over the years from since 2006. We are very optimistic that death due to heart attacks will be further reduced to a minimum in the not too distant future. We are also optimistic that with all the initiatives which we are undertaking to address heart diseases in Dominica, we will improve the quality of life of our citizens in order to contribute to national development. Additionally, it will serve to boost our tourism industry, since many of both our cruise and sailor tourists will feel more confident in the quality of health care services here in Dominica. In the event, would they require specialized cardiovascular services while visiting our nature isle? Madam Speaker, I wish to reassure this Honourable House that the health sector of Dominica is clearly, progressively moving to the next level. Thank you, Madam Speaker.